Good day, everybody, and welcome to the Wellsprings Home Care Podcast. And again, I'll be your host, Justin Curry, and I am the owner and also a certified senior care manager here at Wellsprings Home Care. So, Wellsprings is actually located in Exton, PA, in Chester County, and we serve the counties of Chester, Montgomery, and Delaware. So we're very proud to announce that we were a recipient of the 2020 Best of Home Care Awards from SeniorAdvisor.com. So essentially, what that is it's given out to the top 2 to 3% of home care providers nationwide. So obviously, that's an honor, and we're really excited to announce that. I'm sure if you've listened to the podcast that you've heard it before. But we are excited about it, and we look forward to continuing our growth and hopefully take good care of our clients and bring home more awards. So for those of you that aren't familiar with home care is essentially where a company or an agency like Wellsprings actually sends a caregiver into the client's home or a facility setting. So that would be like an assisted living facility or a skilled nursing facility. We can basically provide care anywhere that's required. It's really customizable to the client and their situation. And some of the services that the caregiver can help out with are personal care, so things like oral care, toileting, bathing, dressing. Mobility assistance is another service. So we actually have caregivers that are specially trained in mobility assistance and fall prevention. And another is dementia and Alzheimer's care. So this is another area that we actually have our caregivers specially trained in so that they can help sort of prevent or slow the progression of dementia and the memory loss. And another service that's provided is transportation, light housekeeping, and also meal preparations. So that's a little intro into Wellsprings and some of the services that we offer. We're proud to have a 4.9 star rating on Google. Yes, you heard that right. We were missing the 0.1 of a star there, so we're working hard to improve on that and get that right back up to 5 star. And SeniorAdvisor.com, we're rated 5 star. So we're excited about our ratings, and we're happy that our clients are happy. So today's topic, what we're going to talk about is signs of depression in seniors. Obviously, depression is one of the biggest problems facing our seniors. You heard that from other podcasts and other blog posts that we've done. And we wanted to dive into a little bit more about the signs of depression and some of the causes, and also, some of the different treatments that can help. So to start off, I just want to talk a little bit about what depression is. So depression is actually defined as a major mental disorder that directly affects a person move in a negative way. So there's a lot of different signs and symptoms of depression. It's a little bit different in every different scenario, every situation, every client, every patient has their own individual signs, symptoms, and also treatments, what works for them. So jumping into what some of the symptoms are. So one of the symptoms would be sadness. If you typically have, one of your loved ones that's typically a very jovial person, a very outgoing, social person, and you've noted that they have a lot of sadness in their daily routine, and they have a lack of interest in doing some of the social activities that they used to. Those can be definite signs of depression. Another one is no appetite. Their appetite, their diet has changed. You can usually notice these trends, especially if you've been around them a lot in the past. Anxiety is another thing. Avoiding social interaction, like we had discussed. And they just typically don't have any interest in social interaction anymore. They don't get any joy out of interacting with others. Insomnia, just an overall lack of sleep. They're looking a little bit rough in the morning, a little bit worse for wear, like they didn't get a great sleep in. Lack of confidence, they've just sort of lost that confidence that they used to have. and unfortunately they're struggling a little bit to get that back. And another would be feeling guilty or unworthy. And these are some of the signs that, like I said, you're going to notice if they're typically, if it's unusual for their character. And one of the more major signs would be any suicidal thoughts or tendencies. Maybe somebody that you know really well, one of your family members or a loved one, brings up something even in a joking manner about suicide. You should definitely take that very seriously and, investigate in that a little bit further. So now we'll jump into maybe what some of the causes are of depression in seniors. So one of the main causes can be obviously health issues. So we're talking about things like disease, disability, chronic pain. These can all contribute to depression, making it worse or instigating it altogether. Medications. There can also be side effects of certain medications that can cause depression. Fears, isolation, and loneliness can lead to depression, and just not having a general sense of purpose. Obviously, once you get a little bit older, not as many people have to rely on you, as far as financially. You're not working anymore, you're retired, so you just generally have less people relying on you. And some of the other causes could be bereavements. So things like death of a family member. Obviously, there's grief involved. Some people, that is kind of a catalyst for depression, and it's really tough to get out of it, even as you start working your way through the grief. So those are some of the causes, and I also wanted to note that seniors are actually at a higher risk of depression. And even more commonly so, it is with seniors that have underlying health illnesses, things like cancer and heart disease. Illnesses like that can really be contributing factors as well. And as per the CDC, which is the Centers for Disease Control, they estimate that 1 to 5% of seniors have depression. So that's not a huge number, but when you get to seniors that do have those underlying health issues, the number jumps up to 13.5% of seniors are depressed, and that's obviously an estimated number, but you can see that it really jumps up with seniors that do need home care services, and that's usually because of limited mobility, disease, just any underlying health conditions. So all of that can contribute to the depression. Now, there's a few different options for treatment. We're not going to get into thorough detail of this, but the first would be self-help. So with self-help, it's just things you do on your own. You're able to do at home. It's little things like exercise. You want to be remaining active. Your diet, you want to maintain that balanced, healthy diet. There's also support groups that you can join with others with depression, and also medical professionals that will help out in those groups. And you should also keep doing any activities you enjoy, even if you're struggling to be excited about them. Sometimes that can help snap a person out of depression. It'll bring back those memories and trigger those memories, and it'll really improve the mood going forward. And the last for self-help would be just making sure you get enough sleep. Obviously, with individuals that have that insomnia and things like that, it's a little bit more of a concern. But overall, you want to be getting, your minimal amount of sleep per night. If you are having sleep issues, insomnia, then you'd want to see a medical professional as well that can help you out with that. And some of the alternatives to self-help are things like therapy. You can actually go in and talk to somebody. Any psychological therapist. Those typically come at a fairly high price range. One of the other options would be taking antidepressants, which obviously your doctor would have to prescribe. So in summary, those are just an overview of some of the signs of depression in seniors, some of the causes, some of the symptoms, how many seniors typically struggle with depression, and then also some of the treatments. Obviously, with any of these topics, we can go into much further detail, but for the purpose of this podcast, we just want to kind of give a general overview of everything. So I really want to thank you for stopping by, and I really hope that offers some insight into signs of depression for seniors. I really look forward to seeing you again next time. Thanks a lot. Bye-bye.